My name is Allie.
I'm Tyler.
I'm Jim.
I'm Audie.
I'm Crystal.
We're Team
Mental Health.
We are tackling the stigma and culture around mental health and how it negatively affects those who may have it.
So a lot of people said that having a friend there to talk to really helped them. Not just knowing that someone cares is really useful.
And we found out a lot of the times that it wasn't the actual person that physically walked into the health center that got help. It was because a friend noticed a pattern in their behavior, or a teacher or someone else reached out to them. Because if you have a broken arm, you're going to go to the hospital, but if you're not feeling well or you can't handle something, it seems that no one wants to actually go get treated. So we decided to tackle, what makes them not want to get treated, and we found that to be culture.
We're really focusing on community building because we found that to be the most important.
And education as well, so making sure that people know that there are resources available to them, and actually making sure people use them and utilize them, that you should be able to.
Also focusing on mass distributing certain notes to raise awareness from the general students body, so they would recognize the importance of this issue.
One thing that was surprising to me, at least, was that a lot of the on-campus resources and student organizations that already exist were a lot about, the theme that kept coming back was suffering. And while it's important to be able to empathize with what people are going through, it's also equally as important, if not more important, to help normalize getting better and normalize recovery and normalize reaching out to other people. And I feel like that's something that isn't addressed on campus, and I thought that was such a glaring misstep in what we have on campus right now. That is, it's a part of the culture that we can fix with some solution.
Different things under it.
Yeah. Well, what do we have? What does it say right now?
It's 80% of college students feel overwhelmed.
Feel overwhelmed.
Yeah, right?
I think 100% of college students feel overwhelmed. Only 20% don't.
What about hopeless? There's a hopeless statistic somewhere around here.
Yeah.
The only thing that, it's just 80% so much. It's so
Does it
impactful.
say overwhelmed or how?
Yeah, so the idea that we ended up going with was this coffee cup, and the idea is you go get your coffee and there's this wrapper, or what do you call it, a hand warmer? Coffee sleeve. So the idea, you got a cup of coffee and there's the sleeve on it. It says, "What am I hiding?" And it prompts you to kind of take it off and see what's underneath. And it says, and there's a fact about mental health, we have 80% of college students feel overwhelmed. Talk to your friends today. And how are you doing saves lives? So it's a reminder that to just be a little bit more aware. And then going off of this, this is intended to connect to a larger network of resources that take existing student behaviors and integrate education about mental health into the normal stream of people's lives. So it wouldn't really be intrusive or require any extra effort. It'd just be it would just kind of become a more integrated awareness, I guess, that really help someone. This is kind of a portal to all of that, just introducing the topic. So yeah, that's the idea that we came up with.
So we decided to do user testing at this event. It's called Arts, Grooves, and Food. And had our cups with our sleeves on them. With our sleeves on them. And we're giving them out. And so far we've seen 3 people, and not a single person has actually pulled down the sleeve. So they'll hold it, and no one has even really read it or taken the initiative to pull down the sleeve. So clearly something needs to be more attractive about telling them to pull down the sleeve, is what we've come up with so far.
And then going off of this is intended to connect to a larger network of resources positioned at everyday touchpoints, available online at the Health Center and at freshman orientation sessions. Our team is motivated to tackle the issue of mental health on a large and small scale. Our first prototype was intended to exist naturally at an everyday touchpoint and to create an active process of discovery between the user and the message. Moving forward as we continue to ideate, prototype, and test, we hope to continue utilizing existing student behavior to introduce our campus community to the appropriate information and behaviors. We have officially partnered with the Sachs Institute for Mental Health, Law, Policy, and Ethics at USC. With the support of founder and director Ellen Sachs, we are engaging in a long-term effort to redesign the current platforms for mental health resources.